Thank you, Stephen, and thank you to the National Institute for having me here today. I want us to reimagine the field of psychology. What is it that we're doing in our area of practice that is contributing to the greater social good? We're going to be talking a little bit about how psychology can be more involved in social justice and advocacy efforts in ways that we aren't currently imagining. We know that in 2012, a lot happened. From COVID-19 exacerbating a lot of the inequities and inequalities in our system, to the Black Lives Matter movement calling for a racial reckoning, seeking justice for those who have been impacted by state-sanctioned violence by law enforcement, to an intense presidential election that divided our country, and kind of thinking about what are the next steps forward in this time of racial reckoning, in this time of a pandemic. It wasn't just us examining how we can impact our society as individuals. It was also us thinking about the field of psychology and where the field of psychology can enter into this space. So over the last year, a lot of people have been thinking about how can I become a better advocate? We were hearing things like, I want to become a better ally. I want to become a better support to marginalized individuals. I want to explore what it means to be involved in social justice efforts. And so I think in psychology, we need to define what that exactly looks like. Historically, advocacy has been poorly defined in the literature. That a lot of times when I talk to different colleagues, they say, you know what, I'm involved in assessment, treatment, research. I don't know if we should be involved in advocacy. Is advocacy have a place in psychology? And I said, well, let's look at kind of the different ways in which advocacy can be formulated into psychological practice. First is public policy. How can we use our science, our knowledge, our expertise to help inform decision makers like legislators or elected officials? I also argued that psychology does a lot of social justice advocacy inherently, that we are seeing clients from all sorts of different walks of life. And we're constantly trying to champion for basic human and civil rights to keep their mental health and well-being intact. And then lastly is professional advocacy. So thinking about our scope of practice in the field. What does it look like when an individual can't get adequate Medicaid reimbursement for services? What does it look like when people don't have access to services in rural communities due to the lack of broadband internet? Moreover, let's think about professional advocacy in terms of our scope of practice. What happens when we think people are intruding on the things that are held near and dear to the field of psychology? And so advocacy has a lot of different places within psychology in its definition. In fact, we do client-centered advocacy all the time in our clinical work, or should embed it more in our clinical work. If we're looking at kind of tackling racism or addressing anti-racism in our practice, client-centered advocacy is really essential in that. How do we empower our clients in this state of distress due to racism and discrimination in order to improve their mental health? Now, there have been a number of studies that individuals who support the goals of the Black Lives Matter movement actually exhibit better mental health and even physical health. That when their physical health is in place, they feel better about themselves and they have better coping responses. And then Garzenka and colleagues talked about how can we talk about white supremacy in the therapy room to foster anti-racism in the treatment space. Again, addressing racial trauma in our therapeutic practice. So client-centered advocacy is something that should be inherent in our practice. And over time, people have thought about different advocacy initiatives, whether it's APA's citizen psychologist movement, to again, thinking about how we support the underserved in access to care, securing funding for training and research. Now, a lot of our research is funded through state and federal funds. And so how do we determine what's funded and what's not? That is by us advocating that we need more money to examine youth suicide in our country. So we need to talk to legislators about supporting funding for that. So when we're thinking about advocacy, we need to think about all the different ways in which we can be advocates for not only our clients, but communities and for ourselves in the profession of psychology. So when we think about psychologists and getting involved in advocacy, there have been barriers historically. That if we did this survey of individuals to see why aren't they engaged in advocacy efforts, these three main areas come about. First is disinterest. So some people say, yeah, simply, I don't want to be interested in advocacy. That's not my space in psychology. I want to stick to other areas of practice. or they've had a bad past professional experience, which has hindered their ability to want to engage. Next, the most common one that I see the most is uncertainty. Feeling that you don't have enough knowledge about certain areas of advocacy efforts or social justice movements, or feeling that you're not persuasive enough. Who is going to listen to me and what I have to say? And then lastly is unawareness. I talk to my students about this a lot. Are you keeping up to date with local news to see kind of what issues are affecting your clients that you're seeing on a day-to-day basis in treatment? So not having that awareness of what's going on in your community or what opportunities there are in your community to advocate. The last kind of barrier that should be highlighted is the lack of advocacy training. That if we look at both undergraduate psychology programs and graduate psychology programs, advocacy training is lacking. Not only for our students, but a number of faculty also report that they haven't had training in advocacy, and so they can't pass that down onto their students. And so training programs also need to highlight this area of practice. That if we look in the field of counseling psychology, advocacy and social justice are actually competencies within the area of counseling psychology. So there should be training and mentorship in these areas at the undergraduate, graduate, and postgraduate levels. So when we're talking about advocacy in the social sciences, it's figuring out ways that we use our expertise, our knowledge, our science to inform and assist decision makers. That people who are in the legislature often are making decisions on areas that they don't have knowledge about. And so it's our duty to help inform them of those different areas of practice, those different areas of science and research to help them make better informed decisions. And then again, how can we speak on behalf of vulnerable groups? Again, we hear a lot of stories from our clients. We get a lot of narratives and research about things that are happening to people on a day-to-day basis. So how can we share those stories to people who are listening and can make decisions? And then lastly, again, the need to advocate for ourselves. If we look at other professions like the medical profession, they're really good at advocating for their selves. Even if we're thinking about prescription privileges, psychiatrists have been really good at thinking about how do we block psychologists from entering our space. So thinking about the ways in which we can advocate for ourselves in terms of scope of practice and research funds is just so important. Lastly, we need to think about what the public thinks of psychology. How are they perceiving us and making our ideas accessible? That over the years that we've gotten a lot of critique from the public about how through their tax dollars, that their tax dollars are often funding services, research at the local and national level, but they never get to have the results of that research. We're often using the public as participants in their research, but they don't hear the outcomes of that research. And so they don't benefit from it. Well, what if we made it more accessible? I talk to people about this all the time that if they wanted to find my research article, they would go to the journal website and it would be behind a paywall and they'd have to pay $50 just to get my one article and find out about my results. Again, some people might see that this is unfair, that again, if a lot of our research is funded by the public, why don't they have access to it? So I want to take a bit of time to talk about my story and why I wanted to get more engaged in this space. Started off my career as a professor at Auburn University in the Department of Psychology, where we had a $2 million contract with the Alabama Department of Youth Services to run the accountability-based sex offender program. That in 1999, all juveniles who were adjudicated for sex offenses needed to receive treatment in the state of Alabama. So if you were adjudicated or convicted of a sex offense, you would receive treatment, which is so great. But what they saw is when they were looking for people to provide that treatment, there were very few people who had that kind of expertise to effectively do evidence-based, competent treatment for these adolescents. So a public-public partnership was formed between the Alabama Department of Youth Services and Auburn University to run this program and do it well. So it was a 60-bed treatment program for boys ages 12 to 21, where they received comprehensive psychological assessments, got matched with a therapist who could meet their needs, went to groups that were tailored based off of the needs that came from their assessments. And then again, we would have some more assessments at post-treatment to see how maybe some of their risk evaluations would decrease with treatment. Just a really great and rich program. And while we were there, me and my students engaged in a lot of applied research. Our students did a lot of the comprehensive evaluations on these boys and found out a lot of information about them, spending anywhere from 12 to 16 hours doing cognitive assessment, personality assessment, risk assessment, and then just generally hearing about their upbringing. And as we heard those stories, a lot of research questions came up for us that we wanted to explore more. Thinking about cognitive functioning and neuropsych functioning. What is happening with a lot of these adjudicated adolescents when they're coming into treatment, but maybe have IQs that are in the low average range? What does that mean for their treatment engagement? What does that mean for their understanding of what's going on in their world and environment? And how might that impact their risk level? Another common theme was trauma. All of these boys had experienced some sort of trauma. When we explored polyvictimization, which was different types of trauma and traumatic experiences through the life course, we saw that some of these kids have experienced sexual abuse, physical abuse, witnessed gang violence in their neighborhoods, had their houses taken out in the Alabama tornadoes, multiple types of different victimizations in their history. But many of them didn't even receive treatment for those victimization histories. And so what does that mean in terms of their ability to attach to caregivers or to treatment providers? And what does that mean for their engagement in the criminal justice system and risk for recidivism? And then lastly, the intersection of race with all these issues. That a lot of our kids were coming from urban communities and again, witnessing a number of the different traumatic experiences in their environments. And they had very different outcomes. That a lot of our kids in our facility who were kids of color were often more likely to go into the adult criminal justice system later down the line in our general population youth. So again, how can we better tailor treatment that can be culturally informed in nature and help support these young men? And then obviously with any treatment program, you want to explore outcomes. And for us with adolescents who are adjudicated for sexual behaviors, we need to explore, would they recidivate? Would they commit another act of sexual violence in the future? And so when I go around and do trainings around the country, I often ask people in the public and even colleagues, what is the recidivism rate for these youth? I often hear numbers 50, 60, 90, 100%. But in our treatment facility, it was 4%. Only 4% of our youth went on to commit a sexual offense. And we would track them over time for a 4 to 6 year period. And again, only 4% of those youth would go on to commit a sexual offense, which was really, really good for our treatment program. So a lot of people ask me, why did I leave that treatment program? What went wrong? That we were doing a lot of great work at that treatment program. I really enjoyed the work I was doing with my students. So why would you leave such a place? Well, I think it was some of the stories, again, that I was hearing from these boys. One, it was disproportionate minority contact that we were witnessing. That me as a Black woman, when I went behind those gates 4 days a week, seeing that a majority of this facility, both with the general population kids and the kids in the sex offender program, were kids of color. And it wasn't just me visually seeing that, it was my students looking at that in their research. That again, if our Black adolescents make up 13% of the Alabama population or the population of youth in the United States, why are they making up 40, 60% of youth who are incarcerated? And so seeing that every day really wore on me, not only as a clinician, but as a Black woman. Then also just thinking about our recidivism rates. And the article came out by Dr. Michael Caldwell about juvenile sexual recidivism. And we found out that our treatment program wasn't that unique, that the base rate of sexual recidivism was around 5% for a lot of different treatment programs across the country. And so with that knowledge, how does that impact policy? Well, a lot of our boys who are in our treatment program, they went on to be on the sex offense registry. What is wrong with the sex offense registry? One, it just plain doesn't work for adolescents or adults. It doesn't make our community safer. It doesn't prevent sexual violence in any way, but it does have a lot of collateral consequences. This report called Raised on a Registry highlights those collateral consequences for youth who have sexually offended and are on the registry. We see heightened rates of youth suicide, heightened rates of harassment of youth and their families after they're released from treatment. And again, these youth will likely never recidivate again. And so thinking about these boys often having their lives ruined by being on this registry was another issue of concern for me. And then when I got home at night, I would turn on my television and see the Black Lives Matter movement happening in action. Again, a state sanctioned violence by police without any sorts of accountability or justice. So when we wrap all of these things together, I had to think about how do I kind of pivot my career in some way? How do I help these youth in our juvenile justice system? How do I help people of color who've been impacted by racial violence and racial trauma? And what does psychology say about all of this? So I had to do a lot of reading and reflecting on this because I didn't really have any models for this. And psychology has always had a place in advocacy and social justice. Whether it was the Clark and Clark Doll study having a big implication in the Brown versus Board of Education decision to end segregation, or the Supreme Court using the APA amicus brief to advocate for marital equality in the United States. And there's so many more examples out there in psychology's history about how we've used our science for the public good. And this article here kind of highlights that. It talks about the history of how we've been involved in so many different ways, whether it's testifying in front of Congress, writing amicus briefs, or doing grassroots activism in our communities as psychologists. And so thinking about how we can have an influence and impact in our systems to not only to help that direct client, but help our communities and help change systems that evoke oppression and discrimination and prejudice. I also had to read on what it means to be a scholar activist. Again, I came from a practitioner scholar program. I knew about science practitioner programs, but I never heard about scholar activism until I started reading up on it. And I said, I want to change my career to embrace activism and become involved in social justice efforts. One of my first stories was when I came to University of Denver, I told the faculty of my goals and how I wanted to pivot my career. And I met with one of our alums who was now involved in public policy. And as I met with him at the end of that meeting, I said, hey, I'm new to Denver. What's going on that I need to know about in terms of scope of practice for psychology? And this alum said, you know, conversion therapy is still happening here and we're trying to end it. And I said, what? We talked about conversion therapy for 5 minutes in grad school, said you don't do conversion therapy, you don't do rebirthing, and that was the end of it. Well, here in Colorado, we were having a lot of cases of LGBTQ youth and also other youth who were undergoing, again, a conversion therapy, which is this unethical, unsupported practice of trying to change one's sexual orientation and gender identity. And I asked him, I said, what can I do? And he said, well, you can testify next week as the bill comes and before the state legislator. And I said, oh, okay. I never knew what it meant to testify. I actually had to look it up. That this was actually, this picture on the right was actually my first time at a state capitol, walking into those doors and testifying before the legislator about this important issue. Because we had things to offer. Like I learned in grad school in my ethics course, this is plainly unethical. And I was able to share that in front of the state legislator. And I'll talk a little bit more about how this ended a little bit later. On the left was me this year, or excuse me, 2020, last year, going in front of the state legislator for the Crown Act. The Crown Act is the Anti-Hair Discrimination Act, that there are people who are being fired in this country because of their hair. And not just people, it's often people of color. So people who are being fired, kids who are being kicked out of school for having their hair in locks or having their hair in braids. When I talk to my students about the Crown Act, they're like, what does hair have to do with psychology? And I had to have that discussion with them of, well, what does it mean to be prejudiced against? What is discrimination? What are the effects of discrimination on youth? And that as a forensic psychologist, we talk a lot about the school to prison pipeline. That if we are instituting policies, zero tolerance policies, discipline policies that are kicking kids out of school, then we're leading them into the criminal justice system. And so here in Colorado, we did pass the Crown Act into law in 2020. And now, again, anti-hair discrimination is no longer allowed in Colorado. And I had to start building connections with a lot of stakeholders in our community. So the top picture, just thinking about cash bail. There were people in Colorado on bail for minor offenses for less than $100. And there was a particular case where a woman was arrested again for a minor misdemeanor offense. Again, couldn't afford $100 bail and ended up dying by suicide. Something that could simply be prevented. Why are we criminalizing people for low level offenses and they can't get out of these jails and prisons for these low level offenses just for $100 or $10? So again, we signed a bill to create a system of no cash bail for municipal offenses in the state of Colorado. And on the bottom, just building connections with other state legislators and talking about COVID-19. What does COVID-19 mean in terms of mental health access? Are we providing mental health services to people in rural communities? We know the digital divide is real and that people don't have access to broadband internet. In fact, there's 30% of Black people in the state of Colorado who don't have access to internet. So what kind of barriers does that create for getting them mental health services, domestic violence services in Colorado? So you see me and my dog there talking to state legislators about the need for increased funding for mental health services and for people in our community during this time of COVID-19. And then lastly, I wanted to get involved in the Black Lives Matter movement. That I came across Black Lives Matter 5280, which is the Denver chapter for the movement of Black Lives. 5280 stands for our elevation. We're the mile-high city at 5280 feet. And I became involved in their education squad. The education squad tackles educational inequities that are happening in our system. So again, fighting those school to prison pipeline issues, advocating for more mental health professionals in schools, and advocating for the support of more Black and brown teachers in schools. And a couple of years ago, we developed a Freedom School. Freedom schools have rich history in the civil rights movement. When we thought there was separate but equal, we know separate but equal didn't exist. That a lot of schools where marginalized youth attended were not having adequate access to services. And then also a lot of our school systems don't have history classes that reflect the history of Black people. And so quickly, one summer, a few of our members went to a conference and they heard about a Freedom School on the East Coast. And they came back and they said, we want to do our first Freedom School. And I was like, that's a great idea for next year. They said, no, we're going to do it this year, which was in 6 weeks. And so we crowdsourced the funding and we ran that Freedom School for a dozen kids in that first year, giving them, again, historically accurate Black history, surrounding them with Black teachers, teaching them how to advocate for their selves in the school system, and also teaching them about the arts from, again, Black teachers. And the Freedom School has grown ever since. We've doubled in the number of students every year. Again, providing them with that rich history, getting them to know Black people in their community. That about a third of our students are Black or African kids who've been adopted by white parents. And those white parents are trying to find them a space in which they can be socialized to love themselves and build a positive Black self-concept. And we've been continuing this work in our community ever since. And even with the Black Lives Matter movement, again, it's not just about police brutality, as I talked about, but it was the impetus for the Black Lives Matter movement. That this year, again, so much attention was brought to the movement with the deaths of George Floyd and Breonna Taylor. But we've been talking about so many other cases before that. One of the cases being our local case of Elijah McClain, a young man who was listening to music on his way home and was stopped by police and injected with ketamine and eventually died a couple days later. And again, this case in the initial protest only had a few dozen people, but after the elevation of the Breonna Taylor and Black Lives Matter movement this year, last year, I know it's 2021 now, a lot of people started figuring out, wait, there's more cases than just George Floyd and Breonna Taylor. There's a bunch that happened in my own community. Why was it that 10,000 people showed up to the Denver State Capitol to protest for George Floyd, but weren't showing up for the other cases that were happening just a few miles down the road? And then does psychology have a place in, again, local politics and local movements? That in 2020, again, as I was talking about state-sanctioned violence by police in our own community, I decided to apply for the Citizen Oversight Board, which is a watchdog group that aims to hold police officers accountable and systems accountable when these acts of excessive force are happening. And so again, I applied for that and I was unanimously appointed to the Citizen Oversight Board in Denver, Colorado as the first psychologist and an activist to figure out how do we apply social science to the Citizen Oversight Board to inform policing. A lot of ideas that were coming up this year in terms of reform was what if we diversify the police force? Will that aid in reducing excessive force? Well, if we look at the psychological and social science literature, it doesn't aid in reducing excessive force violations. Why? Because institutional racism is institutional. So even if we diversify, we're not addressing the underlying problems of policing as a system of institutional racism. And so thinking about how can we apply more of that social sciences to help inform policy and practice. I also thought about, again, the research that, we don't have a lot of training in advocacy and social justice. I didn't have training in it. But when I came to the University of Denver, I was tasked to create an advocacy and public policy course. And again, I think I was learning at the same time as I was teaching this course. And one of my mentors said, you should always have a student at your hip at all times. So that conversion therapy bill that I mentioned earlier actually failed 3 times in a row before it finally passed in its 4th year. So here you see me testifying for the 3rd time, but the 4th time that this bill is being introduced to Colorado on that bill to ban conversion therapy for minors. Again, I'm sitting there with state legislators, my colleagues are in the background, and a couple of my students showed up. And my student was listening to the testimony and said, April, they're missing a couple key points. And I said, hey, why don't you go up there and testify? And so on that picture on the right, you see right by the pillar in the green is one of my students who went up there and said his piece. That again, anybody can go up there and testify and talk about what we know in psychology and how can it inform practice. And again, this was the year it finally passed into law. In our course, we do a lot. We talk about social justice movement efforts. We talk about local policy and local advocacy. Our students are tasked to track one of the bills that's come before this, Colorado State Legislature and make some arguments for or against that bill. They also are tasked to go on field trips. Like myself, a lot of our students hadn't been to a state capitol before. So you see there was one day I couldn't make it to the state capitol, but it was a really highly contested day in terms of reproductive justice and a couple other hot button issues. And my students went by themselves and they actually ran into some of our guest speakers that we've had in the course. And those guest speakers recognized them and invited them into a bunch of different hearings that they might not have had the opportunity to go to otherwise. So when we provide this platform for our students, they become more and more engaged. And we were seeing these changes in our department too, that after the course, our students were saying, what more can we do? This is one class. So how can we build some more representation for public policy and advocacy in our field? So walking in one day and seeing our advocacy group have a Black Lives Matter mural. Some of the students who completed my course went on to create The Advocate, which is a monthly student newsletter talking about other ways in which students in psychology can become involved in their community. It's become a really popular newsletter. Social work students have become involved in the listserv. It's been published. They've won awards for the newsletter. And again, student driven and thinking about ways in which they want to become more involved. Also, again, I said public policy and advocacy is about changing systems. That when I was in Alabama working with those kids who had sexually offended, I had created a theater program partnering with a theater group at the University of Alabama and Auburn University to do these workshops that were therapeutic and creative in nature for our boys. And after I left, I was really sad that I had to leave that space. So when I came to DU, I actually ran into a new professor who did a theater arts program in New York. And so we had a conversation and we said, let's start it here. So the DU Prison Arts Initiative came out of that conversation where we started providing therapeutic and creative arts in prisons throughout Colorado. You see us up here at Sterling Correctional Facility. It's the biggest kind of maximum security prison in the state of Colorado, working with these men, many who are lifers, and just thinking about how do we make amends for our community, and then also how do we keep motivated and sustained when we are going to be in this institution for life. And again, just thinking about space of creativity and play and creating that for them. Again, we always have to have students at the hip. So some of Dr. Ashley Hamilton's students who did an art performance at DU came and spoke to these men and did a first performance at the prison. And so it was their first time doing a play in a prison. So that tasked them with some new things that they had to think about in delivering their performance. And then also, again, having that interaction with men. These are college students who may have never met somebody who was incarcerated before. And again, there's a lot of stigma about who's in our facilities and a lot of dehumanization that goes on. So you see a lot of their kind of perspectives and ideals change as they engage with these men. We also took a look at visitation. I think in psychology, we talk a lot about attachment and parent-child attachment systems. What does it look like in a typical visitation with in prison? Well, you're sitting across a table with your family members and it's kind of boring. You're chatting, but it's not really engaging. Sometimes you don't know what to say to your family members as you're in your jumpsuit. And so we were tasked with changing what visitation looks like. So we started off at Sterling Correctional Facility, which is the men's facility, and then expanded to Denver Women's Facility and started doing some work around the children's book, Where the Wild Things Are. Many of you probably have read it in your own childhood, but bringing that together and doing a lot of performance and art activities through that book. So you see them wearing Max's crown, if you remember the book, and building Max's crown, creating their safe island and what their ideal island looks like. This was so meaningful and just a different way of people engaging with their families. We had so many people come and thank us after these sessions where they were just able to play and eat yummy foods like pizza and soda and cookies. And then it also changed the minds of the people who were working in the prisons. I had one correctional officer come up to me and whisper, "Can I make my own crown?" And I was like, "Yeah, of course you can." And then one day when we were packing up, one of the correctional officers said, "You know what? I've never seen these men like fathers before. I've been working in this institution over 10 years and never really saw them as fathers until today." So we're changing the scope of what it means to kind of see people in corrections. How do we humanize people who are there? How do we build these bonds with families that are often ruptured due to incarceration? So changing the system with what we know in psychology about attachment and attachment systems. Then we have to think about research and how can we take our research to the public, again, since they're not always benefit from it. So I love Linda Trope's book, Making Research Matter, just talking about psychologists and how they engage with the public. That over the last few years, I've had a lot of institutional support. The University of Denver had this public impact fellowship program, taking professors from all different sorts of specialties from across campus and having really a boot camp on how to engage with the public, how to write op-eds, how to engage in media interviews, how to talk to legislators about your research to inform policy and practice. And I've also worked with the Research to Policy collaboration from Penn State, which partners, again, researchers with members of Congress to help inform federal policy. So a lot of these programs are being built to help us navigate how do we bring our research to the public. And I've benefited from it so much. From 2018, being invited to give a TED Talk, again, talking about the experiences of the boys that I met with in the state of Alabama, and talking about the need for comprehensive sex education and consent education. A month after I gave that TED Talk, the ACLU of Colorado and Planned Parenthood of Colorado actually introduced a bill to put more consent education in comprehensive sex ed. And that bill passed into law after I testified and after we got a lot of support for some of that. When I see things in the news that relate to my areas of practice, how can I write op-eds about them? For instance, we had the STEM school shooting here in Colorado, another tragic school shooting here in Colorado. And a week later, our governor was invited to the University of Denver's campus, and they had to ask him about school shootings. And they said, "Governor Polis, what are you going to do about school shootings?" And one of the things he said is, "I'm going to increase school resource officers in schools." Well, again, thinking about the school to prison pipeline and thinking about the research on school resource officers, I said, I don't know if that's the way to go. And so I wrote this op-ed, again, talking about those issues, talking about how it might affect kids of color, and talking about maybe some recommendations for what we should do. What if we put more social workers and mental health providers in schools instead? And so thinking about how can we bring all of this to the public sphere? In times of crisis like COVID-19, how can we pivot some of our research to talk about these hot and button areas? That again, I talk a lot about trauma and victimization. So talking to state legislators on what are the needs of victims and survivors of domestic violence and sexual assault during COVID-19. Again, the incarcerated individuals and what that we work with in Colorado, how is COVID-19 impacting them? So me and my students got together and thought about what are some special considerations we need to think about in terms of incarceration during a global pandemic? How can we possibly mitigate some of the consequences of COVID-19 in a global pandemic? And so we talked a lot about smart decarceration. Smart decarceration is using social science to inform what people can be released early. Some of the people who are chronically ill, some of the people who are on hospice, who are low risk to the community and could return to their families, and again, reduce the risk of COVID-19. And once you start becoming involved, people start seeking you and talking about different areas of expertise with local issues that are occurring. Colorado has one of the highest youth suicide rates in the country. And we're scrambling together with how do we kind of talk about this and how do we deal with it on the forefront. Again, we developed a kind of crisis hotline for at-risk youth in response to a lot of school shootings that were happening. And what happened is after the crisis hotline was instituted, a lot of people were calling about kids who were suicidal. And so in response to those kids who were suicidal, they were often sending police officers to these kids' houses. And I talked with the reporter. I said, I don't know if that's the best idea. Why are we criminalizing suicide for these kids? What does it mean for kids of color who already have mistrust of the police to have a police officer come to their house when they were in a time of crisis? And a lot of people were listening. And it's changed a lot with what's kind of going on in practice as we are kind of informing people about what we know in social sciences about how these different practices are impacting vulnerable people. Again, a lot of my research is about violence and trauma, and I often have to talk about some of the other areas in which we can translate our research to the public. That a few years ago, a friend of mine, a colleague of mine, was asked, do you know anybody who would like to go to Denver Comic Con? And she immediately said April Alexander because she's a huge nerd. And me and my students got together and thought about how can we bring psychology to Comic Con? In that first year we did, it was the year that Wonder Woman came out and a couple other films. And we talked about diversity and inclusion in the comics and what are positive and negative representations. In year two, my colleague, Dr. Tracy Vozar, joined on board and we were able to expand a little bit more. She's the director of infant and early childhood mental health and talks about attachment a lot. And so she said, why do all these Disney and Pixar movies depict trauma and attachment and disconnection with caregivers at an early age? And they talked about the attachment system in pop culture that year. And so every year we have about 100 people in our audience learning about different concepts of psychology that they would have never been exposed to. One year we talked about post-traumatic growth in comics. And we had teachers in the audience who said, how can I create better trauma-informed classrooms? And we were able to engage in dialogue after the conversation. And it's expanded to more fun opportunities along the way of collaborating with Dr. Travis Langley, who is a pop culture psychologist, on a couple chapters in different textbooks. Should we be providing victim empathy treatment to individuals who are diagnosed as psychopaths? What does it mean for Black women to be represented as leaders in Wakanda? And what does that do for Black women leaders or Black people who want to be leaders in the community when they see those positive representations? So there's so many different ways that we can bring psychology to the public. And last, my dog's involved as well. So anybody can be involved in advocacy efforts. Every year we support Freedom Service Dogs, which provides service dogs to military members and veterans in the community. And both of my parents are veterans. And so this is a huge passion of mine and my dog, Jax Alexander. And so I hope that I leave you today with thinking about how can we expand psychology for the public good? There's so much rich research, so much rich clinical experience that we've gathered from psychology that we can bring to stakeholders in the community. People are wanting to listen to us. And so how can we bring it into innovative ways that can really change systems and really advance our reach in who we help in our systems? So I want to thank SPICY and the National Institute for having me here today. And I really look forward to speaking to you all about this in the breakout groups. Always looking for kind of new ideas on how do we expand the scope of our practice and the scope of our work in these areas. And I hope psychology, in the words of President Obama and John Lewis, can make good trouble. So thank you all for having me today. And again, I look forward to speaking to you all in the breakout groups.